Hi there, you're welcome to Dami RX Care, where we talk about medications and how to use them properly. If you're new to our channel, please feel free to hit the like and subscribe button. That way you can get alerts anytime we post our other educating videos. And also feel free to share this video with your friends and family that might be interested in taking this medication. So what is our medication for today? Our medication for today is azithromycin. So azithromycin is a common medication that's used to treat lung infections. So patients will be taking this medication for, let's say, a lung infection, a pneumonia, STD infections such as chlamydia and gonorrhea. Patients take it for Lyme's disease as well as diarrhea, as well, and typhoid. So this medication usually comes in an oral tablet. It comes in an eye drop as well as an IV form. So the IV form is the one that goes in your vein. This medication is popularly used in a dose of what they call the Z-Pack dosing. And the Z-Pack dosing is usually a 6-tablet regimen where the patient takes on the first day 2 tablets, and from day 2 to 5, they take 1 tablet every day till the completion of the medication. So usually patients will start on 500 milligram on the first day, which is 2 of the 250 milligram tablet, and then they would take 250 milligram thereon for the rest of the 4 days. So what are some of the side effects to look out for when taking azithromycin? So a common side effect is diarrhea. I know, right? So we're using it sometimes for traveler's diarrhea, and this is also a common side effect. But traveler's diarrhea is more of a extensive form of diarrhea where the patient can't, you usually have to keep going to the bathroom, maybe due to like a stomach infection or like basically a consistent diarrhea. So patients may also experience gas with this medication or some form of stomach upset. Usually when this happens, they will advise patients to take it with food. You don't have to take it with food, most especially with the regular tablet, but just in case, to kind of reduce that stomach upset, you can take it with food. All right, another common side effect is headache and dizziness. So usually on the first day, I would recommend patients not drive while on this medication, just in case if it makes you dizzy. That way you're not operating any machinery that can kind of be affected while you're on this medication. So what are some of the other serious reactions to look out for? So another serious reaction to look out for would be C. diff. So a patient with recurrent C. diff, you want to make sure that you are kind of being cautious when taking that medication, because excessive antibiotics can cause C. diff, and as you know, azithromycin is also another antibiotic that you're taking, and it's a little bit stronger than regular antibiotics, so you it may kind of provoke that C. diff that the patient may already have previously and cause them to have it again. So just in case if that happens, make sure you reach out to your provider. That way they can stop the medication and give you another medication that might help with whatever infection that they're treating. So another side effect is a serious reaction, which is known as Stevens-Johnson syndrome, or the toxic epidermal necrolysis that happens, which is known as TED. And also another patient, in other patients, they might experience abnormal heart rate. This usually happens if they're already taking another medication that might cause that side effect. So the azithromycin can increase that risk of abnormal heart rate in these patients. All right, so what are some things that you need to know about the medication? So with the regular tablet, like I said, the ones that's regular release, you can take it with or without food. However, with the extended release suspension, you want to make sure you're taking that 1 hour before you eat or 2 hours after you eat. So also with azithromycin, no matter what form of tablet when it's oral, you don't want to take it at the same time with antacids. So you don't want to take it with an antacid that has magnesium or antacid, because they can kind of hold on to that drug and reduce the effectiveness of the medication, which is what we don't want, because we're trying to clear out the infection, right? So make sure you're staying away from those. You can kind of space it out depending on how often that you are, but usually they'll space it out about 4 hours from when you take the antibiotic, or if possible, just kind of skip the antacid and take the antibiotic, and you can resume it back after you stop the antibiotic. So, or after you complete the antibiotics. All right. So what are other things that you need to be aware of? So with the extended release form, if you do vomit or throw up within 1 hour of taking the medication, you can take an additional dose. If you don't vomit within the 1 hour, let's say it's past 1 hour, then you don't have to take an additional dose. All right. And also with pregnant patients, there is no research that says this medication can affect the fetus. So this is something that you want to discuss with your provider to make sure that the benefit outweighs the risk of you taking this drug. That way, you know, they're able to properly recommend that therapy for you. All right, so I hope this video kind of helps in terms of what to look out for while taking the medication. Like I said, if you do enjoy this video, make sure you hit the like and subscribe button. That way you can help support us here at Demi RX Care Community. Thank you and stay blessed. Bye-bye.